Hello everyone, in this video we are going to discuss about flail chest. So whenever there is a blunt trauma to the chest wall, there is more than 3 continuous rib fractures in more than or equal to 2 places. This causes a flail chest segment that moves independently. This is called as a flail chest. So what happens during inspiration is there is negative pressure which causes expansion of the chest wall outside, and due to positive pressure there will be contraction of the chest wall towards inside during expiration. What happens in flail chest is because of this fractures there will be flail segment which is formed. This will in inspiration there will be less negative pressure in this flail chest segment, and this will cause a paradoxical movement. Instead of outside expansion it will move inward. In expiration it will move outward because of less positive pressure. So this paradoxical movement occurs in the flail chest. So the pathophysiology is due to blunt chest trauma there is more than 3 ribs, continuous ribs, and more than 2 places it is injured or fractured. There will be a flail segment or free floating segment which is produced. So this causes paradoxical movement, that is inward movement in inspiration and outward movement in expiration. So this causes ineffective ventilation, causing decrease in the tidal volume of the lung. So there will be shallow rapid breathing with pulmonary contusion, causing decrease in the gas exchange because there will be alveolar hemorrhage and edema because of the pulmonary contusion. So decrease in the gas exchange causes hypoxemia, and there will be increase in the work of breathing to compensate it, and there will be respiratory muscle fatigue, finally leading into respiratory failure. So by definition it is more than 3 continuous rib fractures in more than 2 places causing a free floating chest wall segment is called as a flail chest. The etiology is blunt chest trauma. The key finding will be paradoxical chest movement, inward in inspiration and outward in expiration. So there will be chest wall instability causing ineffective ventilation, causing pulmonary and also pulmonary contusion leading to hypoxemia. So the symptoms are chest pain, tachypnea, shallow breathing, respiratory distress. Signs will be paradoxical chest movement with crepitus, bruit, and asymmetric chest wall expansion because of the paradoxical movement. On chest x-ray we can find rib fractures and underlying lung contusion or hemothorax, and reduced expansion we can see. The complications are atelectasis, pneumonia, and respiratory failure, and acute respiratory distress syndrome. So the treatment can be both medical and surgical management. In mild cases pain control by NSAIDs and nerve blocks can be given, and supplemental oxygen should be given. In cases of severe flail chest, positive pressure ventilation can be given, and mechanical ventilation if there is any respiratory failure, and chest tube can be needed. And surgically we can do rib plating if more than 5 ribs are fractured and there is respiratory failure and there is need for ventilation, continuous ventilation. Goal of treatment is to restore the ventilation, proper oxygenation, and the chest wall stability. So this is flail chest.